welcome to WRPV and WRPV Studios. All right, so in my lifetime, which has been a long time, I've seen things come and go and fads come and go. But what's now come, and it will be here a long time, it's probably been here, but I never really noticed it, which is now med spas. With me is Margaret Flady. Did I get it right?
You did.
Because I got to get to it right away. Okay, so you are an esthetician or?
No, so I am a doctor of nursing practice,
Okay.
and I also am a family nurse practitioner. I've been in healthcare for over 25 years.
Started when she was 2. Go ahead.
Thank you. Nice compliment. And I've been working in the world of surgery for 16, 18 years. So.
Okay, so I know there's a lot of people that open med spas and they're just estheticians. So
Correct.
your place is one step ahead.
Correct. So me having my doctorate and my master's as a nurse practitioner, and the fact that I take continuing education every year throughout my entire career is a little bit different because I have been fortunate to manage multiple medical emergencies when I worked in the operating rooms and the surgery centers and when I rounded at hospitals. So for me, I find that I have all of that added information and knowledge that the small possibility of a complication I'll be able to manage very simply.
Okay, so does where you stand in what you have give you the ability to do things that just estheticians cannot do?
Correct. So the things that I can do, you have to be either a physician or a nurse practitioner or a nurse to be able to do.
Okay, so like, and I'm going to ask you because I don't really know, you do like vitamin B shots?
So vitamin B shots are more towards the primary care type of setting.
Okay.
Things that I do are things of PDO threading. I do medical microneedling.
Okay, so you have to just go back.
Okay,
What the
so
heck is PDO threading?
PDO threading.
I'm a guy. We don't go to med spas.
Correct. Well, I do have clientele of men, so
Okay.
actually I am marketing a lot of men because men also like to look good. But the PDO threading, it's actually using surgical sutures that I place under the skin, and it lifts different areas such as the cheek or the jawline, and it does something like a mini facelift without the invasive surgical procedure. It's done
interesting.
in an office setting. So yes, that's one of my favorite things to do. And then of course I do the medical microneedling where we do tiny little pinpoint punctures in your face or your chest, and it produces collagen and elastin, which then regenerates your skin for healthy skin.
Okay, so you just open the door. You say now you're marketing to men.
Oh yes.
For
Definitely.
what?
So men also have skin and
Yeah,
facial,
we do have some
facial concerns. So I didn't want to just target women because men like to look nice and look well and stay healthy. So I made sure that I incorporate men because Botox I do fillers.
Okay, stop. Let's go to
Yes.
Botox for a second. So, you know, when you watch TV, there's always commercials, and a lot of them are about drugs.
Mm-hmm.
And it says this drug will stop you from coughing, but the side effect is coughing. Okay.
True.
Botox says the commercials kind of put you in a negative light if you're doing it because they say if it gets into a blood vessel, it's an issue.
Correct.
So for me, I would prefer to go to somebody who has medical training than just Mary, who just is an esthetician.
Exactly. And I feel that that's one of the benefits of coming to Higher Self Aesthetics is me working in the world of surgery and being in the medical world for 25 plus years and actually assisting in surgeries and being there for emergencies. I have seen quite a lot and done quite a lot that I would definitely be able to manage something like that in my office setting.
I mean, do they just put that disclaimer there because it's just easy to have the disclaimer?
Well-
Because I know tons of people that get Botox. I think that it's minimal that something ever goes wrong.
Minimal to none, but as you know, everything has to be a disclaimer.
Right.
So it's really one of those disclaimers. But if you're educated and you're experienced, and if you take continuing training, then those chances of happening are very, very slim.
All right, what's the difference between Botox and a filler?
Great question. So Botox basically paralyzes the muscle to reduce the appearance of wrinkles and fine lines, where fillers are used to kind of give a lift and tuck type of a thing. So when we lose our cheeks with natural aging, we can do some cheek fillers to kind of lift them up. People who want more pronounced lips, who were born with very small lips, we can put in fillers into the lips to give them more of a fuller lip appearance.
So, which is the one that makes your face look stiff?
That is the Botox, because we're paralyzing the muscle
Okay.
and we're decreasing the wrinkle effect. But that is the other thing with higher self aesthetics. I encourage more of a natural look,
Right.
where we minimize the effects and appearance of the wrinkles, but we don't want them to be stiff as this table right here.
Okay. What other services do you provide?
So besides the PDO threading, we do PRP.
Okay.
We do the
I know what PRP is, but why don't you explain it?
Great question. So the PRP is actually where I draw some of your blood. I put it into a centrifuge that I have, and then I use a syringe to take out the platelet-rich plasma, and then I can inject it into wrinkles or acne scars or even into the hair follicles of your hair to help restore hair and help bring back the hair follicles.
I'd need like 4 million needles. Okay.
The hair PRP is a little more intensive, but yes,
Is it?
It's a great product because you're using your own component
Right.
from your blood, so the chances of having any type of allergic reaction is essentially non-existent because we're just drawing your blood and spinning it and getting
Putting
the
it back.
plasma and putting it back in.
You know, I guess for most people, they'll, at least I know that if you're talking about something that serious, for me, I would want to be by a doctor.
Mm-hmm.
I don't want to be by just anybody. It's bad enough that we go and we get blood draws from a phlebotomist that's not a doctor.
Correct.
Okay, and they get one shot. When it comes to me, it's
One shot, and that's it.
I'm a tough drawer. So one shot, and I'm done.
I don't
Okay,
blame you.
so you do the PRP.
Yes.
And that, again, that's pretty new, I
Yes.
think.
Yes, it's relatively new. It's something that we haven't concentrated much in the world of medicine or the world of aesthetics, but we're finding that we're getting great, great results. The other thing, Wayne, that we're finding that is amazing is with my PRP machine, I can draw the blood and then I can put it into another device and it actually creates your own filler. So I also have that device instead of using what the pharmaceuticals companies have for the fillers for the lips and the cheeks. I will be able to create your own filler, which again, non-existent possibility of having any allergic reaction, and then I can use it in your face, in your cheeks and lips.
Okay. And this is a question I ask most people that I interview, because being an entrepreneur, you have to be a little crazy. Being an entrepreneur with a brick and mortar, you have to be even more crazy.
Yes.
And being an entrepreneur in the food industry, you have to be totally ridiculous.
Oh, I agree.
So, when you said, hey, I'm going to open a facility, I'm going to do this, did you get family support?
Yes, I'm very blessed with many family and friends and who have always been very, very supportive. So as far as moral support, emotional support,
those things-
absolutely.
I think those
Absolutely.
are a part of being successful in business.
Oh, absolutely. Without having family, friends, connections, without helping the community, forget it. You're not getting anywhere.
Where's your facility located?
So I am in Stewart
Okay.
on 770 Southeast Indian Street
Okay.
in the W Executive Suites.
Oh, I know where that is.
Yes.
And that company has just had exploded in the last couple of years.
It has.
They've
it
opened
has.
all, and you don't. I'm gonna guess that space-wise, it's not something that you need a ton of space. I go to doctor's office, regular doctor's offices, and the room is smaller than the smallest room I have here.
So that's another great comment, Wayne. The issues with the offices, yes. The bigger space, the bigger overhead you have, the more that you have to treat your patients as a factory.
Without a doubt.
I have a smaller space and I'm doing more of a concierge type of a facility, and I'm doing one-on-one. I'm not going to have my patient waiting in my waiting room with 25 other people. It's one person at a time to give them the whole approach, to go through their skin, how healthy their skin is, and what we can do to improve it.
Okay, so I decide that I don't like my face, like most people do. I come to you and I say, hey, this is what I want to change.
Mm-hmm.
So do I have a consultation first?
Absolutely.
And then an appointment is made?
So definitely always start with a consultation, because I want to go and look from the inside out and I want to look at everything. I will review health. I will review your habits, your exercise, your eating, and your skin regimen. I'll cover all of that. And then we talk about what you want done. Now, if it's something quick and simple, then yes, we can do it in the same visit.
Okay, so when you say something quick and simple, what's quick and simple now?
Botox fillers, they don't take long by any means. Things such as PDO threading, they take a little longer. So sometimes a patient might have to come back for that.
Okay, so what about someone who doesn't have good exercise regimen, good eating habits?
Mm-hmm.
It's easy for me to figure out because I know them all. I mean, is there people that would have to wait to do something till they get healthier, for lack of a better word?
No, I don't want people to think that I turn people away. I just want people to understand and know that I want to look at the entire patient and the entire face of the patient to give them the best results.
Of course. I mean,
So
that makes total
if-
sense to me.
Absolutely. But if a patient says, listen, I'm not changing my lifestyle, etc., that's completely on them and I accept that. But to give you the better and best, longest results, I go through that information. But someone who just wants a quick fix, I understand that and it's acceptable, but I do try to give them that extra education.
Okay. Because we were talking in the green room about Botox.
Yes.
And it's done in units.
Yes.
Okay. So how does one decide how many units someone needs? Because I don't think one unit is going to do the job.
No, one unit doesn't. And that's very misleading with some of the marketing when people say, oh, we're $9, $10, $12 a unit. A patient comes in and thinks, okay, I'll spend $50, $60. It doesn't really work that way. With education, we are educated and taught that there's X amount of units that go in your forehead, your crow's, etc. So there's that. And in addition to that, it also depends on whether they've had Botox before, and it also depends on how advanced their wrinkles are. So all of that comes into play. So to say that this patient will get 10 or 20 units, it's more of a complex question than that, because all of those other things need to be considered.
So if someone's already had Botox, does that make it simpler for you?
Well, it can make it simpler, because if they only have a couple of wrinkles and they don't have a forehead full of wrinkles, then I would be able to use less Botox for them. We have patients that come in every 3 months, so they're more of a maintenance versus the person who comes in their very first time ever getting Botox, they'll get more.
Okay, so also I guess if they've gotten it before, they kind of understand the procedure.
Correct.
And that probably makes it a little easier for you.
Correct.
Because they know what to do. So I come in and I get Botox or fillers. Is there a process that I'd have to follow following getting that?
Afterwards?
Yeah.
Yes. So afterwards, there always is a process of maintaining the risk of making sure you don't get an infection, et cetera, which are slim to none, but definitely. So for example, when you get Botox for 4 hours afterwards, you don't want to lay flat, or you don't want to get a massage or acupuncture, because it can kind of migrate where the Botox is. You want to stay in a stand-up position. You don't want to exercise that same day when
that's
you're
a good
doing
part.
Botox. Yes, that's
Got one good part there.
yes,
Okay.
there's a good thing.
I don't want to exercise.
So yes, so there are some of those what we call post-procedural instructions that we let our patients know to get the longest effect of
All right,
it.
we're getting to the top of our time. How do people find you? You have a website?
Yes, so
Which is?
they could just go to higherselfaesthetics.com, or they can give us a call at 561-941-0501.
Okay, so I've said this a million times. I'll say it again. Always, always use a professional. If you don't, it's going to cost you probably 5 times more money-wise and 10 times more at least in frustration. Do your research. Go to somebody who you feel comfortable that they have enough experience. And for me, when it comes to a medical thing, I would always try to use somebody who has medical experience. And that's why, Margaret, we brought you on.
Great,
Everybody,
you.
have a great day. We'll be right back.
Thank you.
Thank you so much.
thank you.
We'll be right back, guys.